Have you ever wondered how much eczema actually impacts someone's quality of life? Whether it's their career or even their relationships, their marriage, and divorce rates as well? Well, you'll learn all about it in this podcast today with a dermatologist that I have on the show who has published over 250 research papers. He has so much experience and so much knowledge on how this skin condition affects our quality of life. So if you're interested in learning more about it, be sure to stay tuned. I definitely learned a lot and I just loved the information that he provided. Don't forget to check out Skin Essa Probiotics if you're interested in a probiotic that has demonstrated in clinical studies to help people achieve clear skin. And 90% of the participants in their clinical study actually saw a difference in their skin. So it's amazing, and I've personally used it before and I really love it. And I always hear great stories from the founder of people who have tried it and have seen a difference as well. So be sure to click the link in my description and it'll automatically take you to their page. Don't forget to connect with me on social media and my website as well to grab my free ebook at eczemaconquerors.com. I hope you enjoy today's episode.
Hi, and welcome to the Eczema Podcast, where you'll learn tips, products, and natural eczema remedies from Abby, registered holistic nutritionist and founder of eczemaconquerors.com. Stay tuned as she invites experts in the field. Here's your host of the Eczema Podcast, Abby.
Hi, everyone. Welcome to another episode of the Eczema Podcast. Today, I have a guest who's been on the show before, and a lot of you loved the information that he shared. So he is back today and he is sharing a lot of great information. We're going to talk about things like the quality of life and how that affects eczema. And there's a lot of fascinating research that he's done. He's published over 200 papers. His name is Dr. Jonathan Silverberg. He is a board-certified dermatologist and he specializes in dermatitis, contact dermatitis, and other inflammatory skin diseases as well, like psoriasis and vitiligo and other skin issues as well. So it's so great to have you on the show again today. Welcome, Dr. Jonathan Silverberg.
Thanks for having me. It's great to be here.
You gave so much great information today, and I just would love to talk more about how eczema affects the quality of life, especially for eczema patients, and I would love to learn some of the fascinating research that you've done in this area.
I think the first thing when it comes to quality of life is that in certain respects, there's almost no two patients that are exactly alike, and that, the eczema can manifest in a lot of different ways and can impact quality of life in a lot of different ways, depending on occupation, age group, and different characteristics. Probably the biggest predictor across the board of quality of life impacts is overall severity. How extensive it is, how severe the itch is, how severe other symptoms are. And there are some nuances there, but generally speaking, the more severe the disease, the worse the quality of life impact there is. Now, where it gets a little complicated is that, and I think most patients with eczema will identify or relate to this statement, it's not the fact that the skin is red that is the biggest issue. Yes, there certainly can be some cosmetic component that's bothersome, but it's all about the itch, right? And how the impact on sleep and the impact on fatigue and mood and other aspects and just our overall sense of well-being. And so it's sort of a bigger picture, and all of those things really impact into quality of life as well. So there's a lot of different tools, a lot of different ways in which this is measured in a research setting and sometimes even clinically. But there's a reason why it's so challenging to capture quality of life. And that's because it's not just one thing in our life that are impacted by eczema. It's like a million things. It's like every aspect of our life can be impacted by it, depending on, again, how bad it is. So, sleep obviously is a very important one. We know that sleep is one of the biggest predictors of our overall health, blood pressure, mental health, physical health. When someone doesn't sleep for, unfortunately, sometimes years at a time with chronic bad disease, that really takes its toll on overall health. And for a number of our research studies, we found that aside from severity, sleep disturbance in of itself is a major predictor of a lot of different downstream problems and quality of life issues. And so if we don't sleep well, there's a lot of other things we're not going to be able to do well during the day. And then that leads to issues of fatigue and just, workplace productivity issues, etc. And we've had patients even get into car accidents because of fatigue and distraction of itch and the sedation from medications and stuff. But all of that feeds into this quality of life issue where we can't do what we want to do. There's a lot of functional impact on quality of life where just our basic activities of daily living. Studies have shown even basic tasks like going shopping, gardening, taking care of the house can be impacted by, by eczema. I've had patients, complain that they flake and scale so much that it leaves a mess all throughout their house. But some of that can be quite annoying. And there's also the emotional aspects in terms of quality of life, where we see higher rates of mental health symptoms of depression, anxiety. And when I have this conversation with patients, sometimes unfortunately, especially in North America, there's a little bit of a stigma around the concept of mental health and getting treatment for mental health. So when I have a conversation about mental health symptoms with patients, they often get very defensive or upset by it. And I try to explain, you're not crazy. This is part of your eczema. And this is actually part of the evolution of my research. When I first started looking at associations with like depression and some of the other things, and I know we'll talk a little bit more about that, I thought of them as being sort of discrete or distinct entities that were somehow not related. And then it became clear, no, these are just symptoms of eczema, like itch, like, pain, like other things. And all of this really drives our quality of life, because when we feel down, right, we're not happy. It's impacting our ability to do things. It impacts our social well-being, right? When you're itching and you're embarrassed to scratch in public, you're not going out in public. When you're covered in open sores and bloody, flaky skin, you're not going to wear certain types of clothing, right? So there's so many different dimensions that are impacted. And then work productivity, right? So for patients, this is not going to be the biggest issue for patients with very mild disease, but certainly in the more severe cases, we have patients who simply just cannot do the job that they need to do at work when they're in the middle of a flare-up. They're so itchy, they're so distracted. They have splits in their fingers, from atopic hand eczema that impacts their dexterity, other issues. So all of these different dimensions can be impacted. But again, it's all going to vary by what body sites are impacted, how extensive it is, how intense the itch is. And again, no two patients are exactly alike in this respect. I think some of the novel things that we've seen recently in terms of quality of life research with atopic dermatitis is that we've looked at a few things, but one of them is this idea of health utilities. So a health utility is something that is used a lot in cost effectiveness research, but it's the idea that can we come up with one single number, in a sense, that describes the overall health or quality of life of a person out there in the population. So there are a number of different tools that have been developed. There's one called the EQ5D. There's another one called SF6D. But what their goal is to try to ask questions about the ability to do basic physical function, impact on mood, things that are shown to be very important aspects to our overall quality of life. And this is not just things that are important for eczema, right? They're important always. And these tools have been developed to try to come up with that one number, like how bad is somebody's quality of life? So we looked at these overall utility scores throughout the US population, in children and in adults, across a few different studies in the past year, 2 years. And what we found was that, not surprisingly, the utility scores were lower in patients with atopic dermatitis compared to those without atopic dermatitis. But what was surprising was that the utility scores were actually worse than almost every other disease we compared them to. And especially when you get into the more moderate to severe forms, worse than even psoriasis, which, right, for folks who've had bad psoriasis know how bad that can be, worse than autoimmune diseases, worse than high blood pressure, diabetes, many other issues. So I think that has really illustrated that, eczema is bad, the toll can be greater than so many other disorders out there. That's something that's provocative, right? I think a lot of doctors who are not used to treating eczema patients, they're not aware of this. And not only that, but I have so many patients who go to doctors who will say, oh, it's just eczema. And when I hear that, I cringe. And I sometimes even get a little upset because maybe in its mildest form, it's, quote, just eczema. But when it gets into that more severe forms, it's not just eczema. It's a moderate to severe atopic dermatitis. It's a debilitating disease, and it's something that should be treated appropriately. So I think it's important to recognize that. Another issue that has come up of recent has been really recognizing the family impact of atopic dermatitis. And this is something that has been known for a while. Certainly, unfortunately, the parents who have children with eczema, they're well aware of the impact, but it hasn't really been studied so much as it should have been in kids. And what we've learned is that the toll of tougher cases of eczema can be enormous on families. We have seen impact leading to higher rates of divorce in the family because it can be such a big stressor in the home. We've seen data to show that higher rates of this concept of co-sleeping, where the child is sleeping in bed with the family, with the parents, that's impacting their ability to sleep, their own work performance and work productivity, parents having to change their own careers just to adapt to the child's eczema. So this really can have a major, major impact. And it's something that has, I think a lot of the doctors and clinicians who treat eczema are aware of this. But this is something that has really been completely missed by certainly insurance companies, not recognizing the toll, not factoring that in when they're willing to cover or not willing to cover medications. And sometimes even amongst clinicians who do treat, who don't necessarily realize how bad the disease can be. And I was actually just having a conversation with one of my colleagues, who was asking me, what are your thoughts about using some of these newer treatments in really young children? And, what if there's some side effect that we don't know about? And I say, look, I get it, but there's a certain time sensitivity and urgency to trying to get these kids better. Because when I have a parent come to me and say to me that I saved her marriage by simply getting her child better, right? What does that tell you? That tells you just how big of an impact on quality of life this disease has for the whole family. And I think that's not something that enough clinicians think about in their decision making, and really should. So those are some of the issues that have come up recently. There's certainly been a lot also that has come up with respect to mental health in particular. I know we'll talk a little bit more about that in depth.
Thank you so much, Dr. John, for just sharing all of that information. And that's crazy how it can even affect divorce rates and the entire family. I know when I was going through it as a young child, it affected my parents a lot, and I can just see how it affects the whole family. Has there ever been any research done on how eczema affects the quality of life compared to cancer? And I know there was that study about how eczema impacts parents who have children who have eczema, and it's the condition that causes the number one stress after cancer. So is there any other research that's compared it?
Yeah, so when we did the studies to look at this impact on the health utility scores, we didn't specifically look at cancer as one of those diseases for comparison. We didn't only because since cancer is much rarer in children, it's just a numbers game. It's hard to find a large enough group of children to compare some of these studies. But when we use these utility scores, keep in mind that they're not specific to eczema or even dermatology. They represent the global health of somebody. And so these are not disease specific and are used across, they can be used even and have been used to study the overall health of cancer patients as well. And actually, there's a variety of different studies that have been done over the years. But when you look at the quality of life impact of eczema and atopic dermatitis, what you actually see is scores that can be comparable. Again, when this is more when you get into that more moderate to severe category. But we see comparable scores in terms of those health utility scores, and sometimes even worse. And I'll just give you an example. When you look at some of the studies that are out there that have looked at utility scores within the cancer population, of course, right, there's so many different types of cancers, there's different stages, there's different treatments, right? But when you look across some of those populations, you'll see utility scores ranging from anywhere around 0.4 to 0.6 on a scale of 0 to 1, where 1 is like perfect health, 0 is worst possible health. And, usually normal is somewhere around 0.8-ish. So you see big drops from 0.8 to 0.6, maybe down to 0.4. Guess what? You see the same drops in eczema. Even in mild disease, you see drops in these utility scores down to like 0.7-ish. And when you get to really severe disease, you can get scores down into the 0.3 range. And again, this is something that most doctors would be scratching their head. How could that be? In fact, I was at a meeting called the ICER meeting. There's when dupilumab, the one of the newer medications, was approved, there was a group got together of doctors, this group called ICER, to try to review how effective it is and should it be considered cost effective or not, and whether or not insurance companies should cover it. And when we talked about these utility scores, and these were utility scores that were seen in the clinical trials, there were a lot of these doctors, primary care doctors, pediatricians, oncologists, who were saying, no way, can't be that the utility scores are that low for just eczema. And I'm sitting there, I'm in the peanut gallery, and I actually, because as part of our intake, when we screen patients, we do these global health scores to see just how much it's impacting patients' health. And I said, well, actually, I do this on a daily basis, and we see utility scores in our tougher patients down to 0.3 range. And that silenced the room because it was something, personal experience showed that this is a real thing. And so thankfully, eczema doesn't kill like cancer and so many other disorders. And I'm very thankful for that, obviously. But that doesn't mean that it isn't debilitating and a major, major impactor on quality of life.
That's so interesting. Thank you for sharing that. And definitely there's that huge impact with how skin has such a detrimental effect, not just on quality of life, but emotional health as well, which we'll go into more detail later in our other podcast. But what about the stats or any research that has been done on, you mentioned earlier, there's higher divorce rates. Has there been any actual stats that show how much higher the divorce rates are, or either how eczema impacts dating, marriage, and the family?
Yeah, so that's a great question. Questions, plural. So when we looked in the U.S. population, across the whole population, you don't see a massive increase, fortunately, in divorce rates, right? It's statistically significant. It's there. But fortunately, across the population, most cases will be on the milder side, right? When you look at some of the epidemiology, 2/3 of pediatric cases will be mild, 25% moderate, 8% severe. And it's definitely going to be the more severe ones where this happens. So we're reassured that the majority of cases which are milder are going to be less of a stressor in the home. But of course, if it's even one divorce caused by eczema, it's one too many in that respect, so we're sensitive to that. So it's not an enormous number, thankfully. But in terms of dating and relationships, almost all patients grapple with this in some shape or form throughout their life. And the dating situation is not one that has been well studied, but I can tell you just from talking to patients that almost everyone deals with this. And to the extent that, it's interesting because it's a little bit of a nerdy methodology concept as well. But, when you use these quality of life tools to ask somebody, well, how does the eczema impact their relationships, right? That's one of the questions in some of the common quality of life tools that are out there. And many patients will say, well, it doesn't. And then you probe and you're like, well, you have the worst disease possible. How could it not affect your relationship? Well, it took me a while, but I found a partner who actually doesn't mind or who is tolerant of it, right? So it impacts our decision-making. And sometimes we adjust our lives around that. We adjust our career choices around that. I asked the patient, how does it affect, how does the eczema affect your work? And he said, well, it doesn't. I said, and I'm looking at the skin. I'm saying, you're one of the toughest cases I've ever seen. How can it not affect your work? And I said, so what do you do for work? He said, well, I'm a professional gamer. And then I realized, well, okay, yes, you've chosen to sit indoors and hide behind a firewall in how you interact with people, right? That's not a coincidence. Not, some people are amazing gamers and will do that even without eczema. I'm not trying to be disparaging, but once his eczema got better, and it took a long time till we found something that worked, he went out and he got a job, and he got almost immediately promoted to manager. And it was one of those, amazing tearful moments where he came back in and we hugged, it was like, because once we fixed the eczema, it changed the whole situation. So there's a lot of things that as patients, we cope, we adapt. And we sometimes, just assume that that's all there is. And we don't think about what comes beyond that. So when it comes to dating, that we cope and we adapt, because if there's a partner out there, a potential partner out there who's a jerk and who doesn't, who can't deal with it, well, that's not a relationship that's going to last. And so, but it definitely impacts things. There's no question. There's studies that have been done, well done studies showing that there's, higher rates of stigma, people fearing how they'll be looked at in the workplace, how they'll be looked at in relationships, people thinking that it's contagious because they just don't know and they're ignorant about it. And so they look at someone with eczema and they don't know how to deal with those issues. So there's definitely impacts there, but it's something that, again, we can find coping mechanisms, but it is definitely something, and I think it's particularly relevant in young adults and adolescents, where a big part, we'll have patients come in and say, I have a wedding I'm going to next week. I'm a bridesmaid and I'm flaring up and you need to get me clear like yesterday. And so, yeah, right. I mean, it's something that and when I always call that the wedding scenario, when there's that time is of the essence, it changes how quickly we expect therapies to work and how strong we have to, have to treat it to get it under control.
That is so interesting. Well, thank you for all the information that you gave about this. Is there any last stats or interesting research that you want to add about this before we move on to our next topic for our next episode?
Yeah, I think the one last point I would just add in is, when we talk about how atopic dermatitis can be associated with quality of life, we can't just focus in only on the skin. We have to sort of look at a holistic approach at the overall sort of what we call the comorbidities. And one of, the big sort of families or groups of comorbidities that comes up with atopic dermatitis is the allergic disease, right? Food allergies, asthma, hay fever. Those also come with quality of life impact. And so it's something that I think the next generation of research from a therapeutic standpoint, from, understanding this more and more, is not just to say, okay, how bad is quality of life in a patient with eczema, but it's really trying to parcel out and understand those comorbidities. Because, as a dermatologist, when we're siloed and when we're not trying to manage the whole patient, we miss things and we're not getting the full quality of life better. And so I think to me, it's sort of a big plug for more interdisciplinary care strategies, trying to manage that whole patient. Not always easy to do in different healthcare settings, but I think a very important goal to aim for.
Thank you for sharing that. Also, just out of curiosity, has there been anyone who has written more papers than you, more than the 200 mark, or are you?
There are. There's actually a paper that was published by a research group, I think last year in one of the main journals. I can't remember what the term they used was. They called it like super prolific or something like that authors, super productive authors. There's lots of folks. There are folks who have over 1,000 publications out there. It's a relative rarity. I mean, we've hit over 350 now, so there's a lot. But listen, I love it. And, to me, it's what drives it is my patients. Most of the, so-called hypotheses and ideas that we have tested have come straight from patients' experiences and trying to better describe that and find solutions to those problems. So, I think of a lot of the research that we do in terms of understanding quality of life as almost advocacy for patients, because when payers, when regulatory agencies, when companies say, oh, it's just eczema, why do we need more treatments? Or why should we approve this new treatment? Or why should we cover this new treatment? Well, here you have hard data to show, no, it's not just eczema. Again, and it's patients desperately need new therapies that are really effective and safe. And so for me, a lot of it is just, it's an advocacy piece that patients, caregivers, other doctors, regulatory agencies should all understand just how this disease impacts patients' lives.
Thank you so much. And thank you for all that you do for studying and researching into this. I think that it's bringing a lot of light into how much this condition affects our quality of life. And we're just so appreciative that you're also using this research for advocacy too. So thank you so much for that, Dr. John.
My pleasure.
Thanks for listening to the Eczema Podcast. And stay tuned for our next episode. If you like what you just heard, we hope you'll pass it along to your friends. Visit eczemaconquerors.com for more articles and tips. Thanks for listening.